everyone, this is Suprabha. Welcome back to another session with me. In today's session, we will be discussing about anemias in children. Well, first let us understand what is the meaning of anemia. So when there is reduction of hemoglobin concentration or hematocrit below the level of normal for that age and sex, we call it as anemia. So that means at a particular age and for a particular sex, there is a specific level of hematocrit or hemoglobin that should be there, right? So when there is the hemoglobin concentration is less than that normal level, we call it as anemia. Well, so here we are saying that if the HP concentration is below normal level, we call it as anemia, right? So next we should know, what is the normal level of HP concentration at a specific age, right? So first, we would see in children what it is, right? So in children, that is 0.5 to 5 years, it is 11 gram per DL. So till 5 years of age, their normal hemoglobin concentration would be 11 gram per DL. So if it is below than that, we'll call it as anemia. And then from 5 to 12 years of children, it should be 11.5 gram per DL. And for 12 to 15 years of children, it is 12 gram per DL. So these are the normal hemoglobin concentration. So when there is, when the hemoglobin concentration is below this, that means the child is anemic. Then we also have women who are, above 15 years old and they are non-pregnant. So for them, it would be 12 gram per DL, and women who are pregnant, for them, it is 11 gram per DL. And for men who are above 15 years old, for them, it is 13 gram per DL. So these are the normal hemoglobin concentration according to the age group. Well, so till now we understood what we mean by anemia and when to call it as anemia, right? Now next let us learn about the classification. So there are several types of anemias. It can be, there are different causes, there are different diseases and disorders which might cause anemia. So first let us see based on which all factors we can classify anemia, right? So the first thing is etiological. So based on the causes of anemia, we can classify anemia into different types. And then the next one is morphological, the third one is pathophysiological, and the fourth one is severity. So these are, certain factors based on which we can actually classify anemia into different types. Well, first let us talk about the etiological classification. Now, when we are talking about etiology, majorly we can say that there can be two things, right? The first thing can be that there is decreased production. For example, if there is bone marrow suppression, in that case, it is not being produced, right? The production is decreased. And the second thing can be there is increased loss. So, the production is proper, but due to increased loss, what is happening? The child is having less hemoglobin, right? So, increased loss can be due to hemorrhage, or if there is increased destruction, in that case also, there can be increased loss, right? So, etiology can be of, majorly can be of these two things. So let us see how we can classify anemia according to the cause. So the first one is anemia due to blood loss. Now, due to blood loss, it can be, acute post-hemorrhagic or it can be chronic post-hemorrhagic. Now, what is acute post-hemorrhagic? Now, this occurs due to an accident where, there's a large amount of blood loss. And the next one is chronic post-hemorrhagic. Now, this happens over a period of time. So, this is here what we can see is that there will be small amount of blood loss, but it will happen over a long period of time, right? So, that's the reason it's called as chronic post-hemorrhagic. Now, in which all cases, there can be blood loss continuously from our body. So if there is hookworm infestation, or if there is chronic duodenal ulcer, or if there is piles, in all these cases, there would be, very small amount of blood loss will be there, but it will be continuous. And also it would be present over over a long period of time. So that is what is chronic post-hemorrhagic. So the first one was due to blood loss. Now the second one is due to impaired red cell formation. Now, impaired cell formation, also here also we have two things. That is, first thing is due to disturbance of bone marrow function due to deficiency of factors necessary for erythropoiesis. So there are certain factors which are required for erythropoiesis, and if there is deficiency of those factors, then definitely what's going to happen, there would be disturbance in the bone marrow function. And the second one is it's disturbance of bone marrow function, but it is not due to, or it's not related to the factors which are necessary for erythropoiesis. So the first one is the dysfunction or the disturbance of bone marrow function is due to deficiency of factors necessary for erythropoiesis, right? So here we have two types of anemia. That is, the first one is iron deficiency anemia, and the second one is megaloblastic anemia. So that means iron deficiency anemia and megaloblastic anemia. These two are definitely happening because of, there is disturbance of bone marrow function, but also it is related to the disturbance of the bone marrow function is related to the deficiency of factors necessary for erythropoiesis. So that means here the factors which are required for erythropoiesis is not enough, right? So there is deficiency of those factors, and that is the reason there is disturbance in the bone marrow function, and because of that which anemia happens, we call it as iron deficiency anemia and megaloblastic anemia. Now the next one is, there is again disturbance of the bone marrow function, but this time it is not related to the factors which are required for erythropoiesis. So there might be anemia associated with chronic infection. Now, for example, if there is renal failure, if there is liver disease or disseminated malignancy, in all these cases, again there might be bone marrow dysfunction. Again, if there is bone marrow infiltration, or if there is aplastic anemia or anemia associated with myxedema or hypopituitarism. Well, so these are some of the cases where again there might be bone marrow dysfunction, but not related to the erythropoietin factors. Now the next one is anemia caused by excessive red cell destruction. So when there is anemia due to excessive red cell destruction, we call it as hemolytic anemias. Now again, in hemolytic anemias, we basically have two types, we can say, that is intracorpuscular cause and extracorpuscular cause. Now in intracorpuscular causes, again there might be two things. The first thing might be decreased production of hemoglobin, which we call it as thalassemia, and second, there might be abnormal production of hemoglobin, which we call it as sickle cell anemia. And then there are extracorpuscular causes. So next, let us move on to the morphological classification. In morphological classification, we would consider the size and color of RBCs. And in that, we have three major types, that is normocytic, normochromic. The second one is microcytic, hypochromic, and the third one is macrocytic anemia. So first, let us talk about the normocytic, normochromic anemia. Now here, the mean corpuscular volume, the mean corpuscular hemoglobin, and the mean corpuscular hemoglobin concentration, all these things will be normal. So example of normocytic, normochromic anemia would be aplastic anemia or acute post-hemorrhagic anemia. The second one is microcytic hypochromic anemia. So here we can see that the MCV and the MCH and also the MCHC, all these things would be decreased. So their concentration or their level would be decreased. So example of microcytic hypochromic anemia is iron deficiency anemia. And the third one is macrocytic anemia. So in macrocytic anemia, the mean corpuscular volume or the MCV would be raised. So an example of a macrocytic anemia would be megaloblastic anemia. Well, next let us move on to the pathophysiological classification. Now, pathophysiological classification means how anemia occurs, right? So, there are several types of anemia, and each of these anemias would have different pathophysiology and a different mechanism of occurrence. So it can be due to increased demand, for example, infancy and childhood. Now, as you know that they are at a stage where the most of the growth and development occurs, right? So they are growing rapidly, and that's the reason they need more iron. So again, that can be a cause. The apart from infancy and childhood, again there might be pregnant mothers. So during pregnancy, again there is increased demand for iron. Next, there might be decreased production and there might be increased loss. Next, let us see what is the classification based on severity. Now, the hemoglobin concentration would definitely tell us how severe the anemia is, right? So, it starts from moderate to severe and then very severe. So, if the hemoglobin concentration is, in between 7 to 10.9 gram per dl, in that case, we call it as moderate anemia. If it is from 4 to 6.9 gram per dl, then it is a severe case of anemia. And if it is less than 4 gram per dl, then it is very severe. So that's all about the classification. Now next, let us move on to the clinical features. So if there is anemia in children, what are the signs and symptoms that we can see? So the first one is easy fatigability. So the child will feel easily fatigued. Now why this would happen? Because what is happening in anemia, that there is lack of healthy red blood cells, right? Now what these red blood cells do, these red blood cells carry adequate oxygen to your bodies or to your tissues, right? So if there is lack of healthy red blood cells, then what is going to happen? There won't be enough or adequate oxygen reaching to the tissues, right? So that's the reason child will feel easily fatigued. Again, the child will have shortness of breath, lethargy, the child will feel drowsy, and dizziness will be there. Now all these things are because of as there is enough oxygen or adequate oxygen is not reaching to the tissues. Apart from these, a child might have headache, palpitations, or pica signs. Also we can see there might be pallor, angular chelosis, beefy tongue, tachycardia, and even the child might have pharyngeal webs, and also there might be tongue changes. So these are the clinical features. Now next, let us move on to the laboratory diagnosis. Now how or what are the lab investigations that we can do to find out anemia? So the first thing that we can do would be red cell indices, where we can learn about the low hemoglobin concentration, or the MCV values, or MCH or MCHC values. We can also do blood films. We can also check the bone marrow iron, and apart from these, we can do chemical testing on serum. So all these things would tell us if it is a case of anemia, how severe it is, and what is the cause behind it. So next, let us move on to the complications. Now, anemia can actually, affect the child very severely. So there might be circulatory collapse and shock. There might be cardiac enlargement, or also, systemic or local infection might be there. And along with these things, there might be growth retardation, mental retardation, or sluggishness with decreased attention span and intelligence. And along with all these, there would be delayed puberty. So these are some of the complications that might occur if the child has anemia and if it is not treated properly. Well, so let us conclude our today's topic here. So today we learned about anemia in children. So we learned what we mean by anemia, what are the hemoglobin concentration at according to the specific age group, and the classification of anemia, and also the complications, and the laboratory diagnosis, right? So I hope you have got a better insight about the topic. Thank you.